Hello friends, so today we are going to discuss about the drug is tetracycline. Tetracycline. So the tetracycline group, it's a bacteriostatic drug. Bacteriostatic. In the tetracycline drug, there are 4 rings. So there is 4 rings. So suppose this is the rings. And the 4 rings of PUC, poly unsaturated cyclohexane ring, and in the middle there is a nucleus. The nucleus is naphthacene nucleus. So in the tetracycline there are 4 ring of partially unsaturated cyclohexane ring and one nucleus, that is naphthacene nucleus. And now the spectrum. The tetracycline is a broad spectrum drug. So it is a broad spectrum antibiotic, as it covers gram-positive bacteria, gram-negative bacteria, and some protozoa like amoeba, and it also covers the intracellular organism like rickettsia, chlamydia, and cell wall-less bacteria like mycoplasma. Now the mechanism of action. The tetracycline, it inhibits, so it binds with, so at first it binds with 30S ribosomal subunit, then inhibits protein synthesis, and it reduces the growth and the multiplication of bacteria. So it reduces growth and multiplication of bacteria. So it is a bacteriostatic drug. Bacteriostatic action. Now the drugs. The drugs are at first tetracycline. Another usable drug is doxycycline, and minocycline. The tetracycline, it is natural, and these two are semi-synthetic drug. Now some important discussion about the doxycycline. Let me tell you the doxycycline. Doxycycline, it is a semi-synthetic drug and it is taken orally. Then when the doxycycline is taken, so at first হচ্ছে doxycycline. Suppose this is the drugs and here is the GI tract. So here is the GI tract. So doxycycline, it is, after taking, it is absorbed and goes into the blood circulation. So this is the blood circulation. The absorption is not impaired by food. So suppose this is the food, and the absorption of doxycycline not impaired. So absorption not impaired by food. So as the absorption is not impaired by food in case of doxycycline, so there is increased absorption. As there is increased absorption, so the bioavailability of the drug is increased. So bioavailability is very high. When more drug is in the blood as increased bioavailability, then this drug binds with the plasma protein. So doxycycline, it binds with the plasma protein. About 80% it is bind with the plasma protein. When it is bounded with plasma, so they remains longer time in the blood. So the T half of doxycycline is increased, As the THAP is increased, so it is called a long-acting antibiotic. Long-acting antibiotic. As it is long-acting, so less frequent dosing is needed. Less dosing is needed. Another important topic, that the drug doxycycline, it is eliminated by bile and feces. So it is eliminated by bile and feces. And as it eliminated by bile and feces, so it also have the enterohepatic circulation. Enterohepatic circulation. And one more thing, that as it is eliminated by bile and feces, so it is less nephrotoxic. So less nephrotoxic. As it is less nephrotoxic, so it can be used. So it can be used in renal failure. In renal failure. And another important topic, doxycycline is absorbed more. So as it absorbed more, so there is less interaction between the doxycycline and the food particles. So less GI upset. Less GI upset, and it also causes less alteration of gut flora. As it is causes less alteration of the gut flora, it causes less chance of diarrhea. Less chance of diarrhea in case of doxycycline or minocycline, means semi-synthetic drug. But in case of tetracycline, its absorption is impaired by food. So tetracycline absorption impaired by food. So it should be taken empty stomach, either before meal or 2 hours after taking meal. But doxycycline can be taken with the foods. And doxycycline should be taken with half glass of water, or more fluid should be taken. And to reduces the GI upset, number one thing, more fluid intake, and not to lie not lying after taking drugs at least 30 minutes. So patient should sit or stand or walking, like not to lie, as it causes heartburn. So to reduce the GI upset, more fluid intake, and not to lie after taking the drugs at least 30 minutes. So at least 30 minutes we should stand, walking, or sit position. Now the indications. The indications of tetracyclines are tetracycline indication. So I have made a mnemonic, that V cards. So V stand for venereal disease. Venereal disease like lymphogranuloma, venerum, or granuloma inguinale. Then C stands for chlamydial infection, and also cholera. A stands for acne and atypical pneumonia. Mainly by mycoplasma pneumoniae. Number 3, R for rickettsia. It is important. In rickettsial disease, like Rocky Mountain fever or Q fever or typhus fever, so in rickettsia it is used. And S for spirochete. And also tularemia or brucellosis or plague we can use aminoglycoside and also tetracycline. Aminoglycoside and also tetracycline. And the common use of the doxycycline are M caps. So at first cap means community acquired pneumonia. C stand for CAPS, community acquired pneumonia. Then A stand for anthrax, and also acute exacerbation of bronchitis. P stand for chronic prostatitis. S stand for sinusitis. And M for malarial treatment and prophylaxis. And also doxycycline is another use, like we use doxycycline plus ciprofloxacin, doxy plus cipro, where in case of epididymoorchitis, we use a cipro plus doxy. So this is the common indication of the tetracycline. Now the side effects. So in case of tetracycline, it causes number 1 GI upset, like nausea, vomiting, diarrhea, nephrotoxicity, hepatotoxicity. Then it also causes superinfection, mainly by the Clostridium difficile induced diarrhea. So it can cause superinfections, and it also causes the local tissue injury. Like when we give IV, it can cause venous thrombosis, and also cause hypersensitivity reaction like rash, urticaria, and anaphylaxis. And in case of doxycycline, it can causes number 1 photosensitivity, and number 2 vestibular reaction, like vertigo and dizziness. So this is the side effects of the tetracycline groups, means tetracycline and doxycyclines. Now the contraindication. So at first, suppose this is the teeth and this is the bones, and in the teeth and the bone there is calcium. Okay, so there is calcium. When we give tetracycline, it binds with the calcium and it removes calcium from the teeth and from the bones. Then it causes number 1 discolor of the teeth, number 2 enamel dysplasia, as a result dental caries. And another important thing, that it can cause bone deformity. As a result, there is a growth inhibition. So in this case, because due to these causes, it is not used in pregnancy, number 2 lactation, if the age less than 10 years, and patient with hepatic and renal disease. Now the last topic, tetracycline. The tetracycline, if we use simultaneous use, like if we use tetracycline plus penicillin, it causes inactivation. If we use tetracycline with diuretics, it can cause blood urea nitrogen raised. If we tetracycline usually negatively charged, so if we use any positively charged like calcium ion or magnesium or aluminium or iron, so it can causes chelation and also causes inactivation. So where we found calcium? We found milk and milk product. Magnesium and aluminium from antacid, and from iron tablet. And if we give tetracycline intrathecal, it can cause raised ICP. And if we use tetracycline in IM, then it can cause local painful irritation. So this is some uses of tetracycline and some interaction. And thank you for watching. Assalamu alaikum.